First and foremost, it has to start with an affordable health cost. Obviously, a reduction in health costs where possible. Secondly is an improvement of productivity, because as you improve health, you have an opportunity to improve productivity. And the third, and arguably most difficult to gather, is then an improvement in overall employee loyalty, service delivery, etc. As a company, we're focused on improving health, well-being, and security, so it lines up exactly what we're focused on, extending from a sick care company to a company focused on health and health improvement, and making sure we have the programs both for our employees as well as for our customers. First and foremost, the benefit design has to have some incentives and some aligned accountability for their individual employees. That's most important. Second is ensuring that they have the effective programs for the people with chronic care. And third, very importantly, is to make sure they're expending enough energy on their healthy at-risk population to help to keep people from falling into that chronic and acute bucket going forward. So those are awareness, lifestyle management programs, health improvement programs that are critical. Each of those have to line up to help employers take the right steps forward. Affordability is obviously a challenge for everyone, but specific to lower wage earners. We believe employers need to offer a bit more choice than maybe has historically been afforded to folks, and then engage their individual employees in some of the trade-offs that are necessary there. We think any choice has to have full coverage of prevention and wellness as well as catastrophic coverage. Then you can build up from there as opposed to pulling coverages down. For pre-retirees, it's highly dependent upon what programs they're coming from before they're Medicare eligible. But we believe the same tenets exist to make sure those pre-retirees have choice, have some individual responsibility, and begin to start to proactively save for some of their future needs to augment the Medicare programs as well. Workforce health, we think you have to address multi-channel. So multi-channel means telephonic programs, web-based programs, as well as, if there's enough scale, on-site health delivery is rather important. The overriding umbrella to that, though, needs to be a high level of awareness from the employer, top-down, and some responsibility for the operational leadership to support health, wellness programs, and health improvement programs within the employer. Given the affordability challenge, you could see some rather significant leaps forward. So, for example, blurring the line in terms of health delivery to the web-based or on-site healthcare delivery, a significant increase in individual responsibility and incentives that support that. And we believe that you'll see much more of an extension of the public system with more means-based subsidies that actually attach back to some of the affordability challenges for a few. We think it's going to be a very active debate and conversation. We think we'll see a significant amount of change, and there needs to be some change to the system. So we're open to and highly supportive of that. The change needs to be much more than the financing of healthcare, and the debate needs to address the health improvement programs and provide incentives for employers or cities or counties or states to address health improvement, and that will be a benefit to the health dividend. We also believe that the state or federal programs will apply more subsidy and support, which will augment some of the services that employers deliver. A caution we have, though, is that that public policy change not undermine the power of what the employer-sponsored system has the ability to do through pulling individuals together as a community and really driving the appropriate level of engagement that we all need.